I chose Creighton University's doctoral program over other programs because I graduated from one of the top universities in the country for my master's degree in occupational therapy, and I just wasn't willing to settle.
I chose Creighton because the campus is a Catholic university, and they use Ignatian values that I possess in my spiritual life.
I'm a graduate of Creighton. My first OT degree was from Creighton. I live in Omaha, so that was convenient. I just really didn't think of anywhere else besides Creighton, actually.
Probably one of the greatest strengths of Creighton's program lies in the professors themselves. As you'll see, most of the professors are authorities in their specialty, and that was something that was a must for me when I was looking at different curriculums.
The occupational therapy faculty at Creighton, they're very distinguished and very outstanding faculty that have wholeheartedly supported me in a lot of my self-directed pursuits and interests.
I love the flexibility, the doing it online, being able to sit down and do my homework or do the discussions whenever I want. I'm a mom of two and I work full-time, so it's important for me to have some time that I can do it when I'm not spending time with my family or at home.
And you can allow yourself to take courses at your own schedule without feeling too overwhelmed while having the simultaneous obligations of working and having families.
I think what's unique about this experience is that the professors know that we have outside obligations. They know that we are, non-traditional students. We're older, we have jobs, we have children, some of us, and that's understood.
The flexibility of the program, I'm able to work, still have a life, and be able to earn a degree of a higher nature that most individuals shy from because of the time commitment. But I'm given the opportunity to work on my schedule as well as keep my clinical practice and now teach. So I've done all three and succeeded now graduating, so it's a good program for me.
The Creighton University program in occupational therapy has given me more confidence as a professional. To say that you've graduated from one of the top universities for a doctoral degree in occupational therapy, I think says a lot. And because of that, I have a lot more confidence in my skills and the approach that I take with my patients.
Strengths of the post-professional distance-based program entail the fact that it's a very innovative, cutting-edge program in terms of web-based technology due to the online distance-based nature of the courses. And it's a very rigorous program, makes it very competitive. You feel very prepared to go out and utilize your additional advanced degree.
When looking at different curriculums, I would just recommend, reckoning with yourself in terms of, what are you willing to settle for? What responsibility do you have as a professional in the field of occupational therapy? Getting a doctorate from a program that's less rigorous and quite often less lengthy, is that going to set you apart? Is that going to make you a steward in the profession of occupational therapy?
The rigor here at Creighton University allows you to feel like once you graduated, you did something, you accomplished something. You walk across that stage proud that you're earning the degree that you came for, not just learning a textbook. You learned a whole lot more. So the rigor helps you overall and gives you that confidence when you walk across the stage.
To see that all of my hard work these last years at Creighton has really paid off, and I really can approach anything I want to with courage and confidence.
I wanted to grow professionally and expand my professional, academic, and clinical foundation in ways that would just allow me to continue to advance in the profession as a whole, also for the betterment of society and those clients that I serve.
I'm very proud to be able to do this that's always been my ultimate goal when I started the program. Number one, how can I gain knowledge about my profession? And number two, how can I better serve?
My colleagues always ask me, is it worth going back and getting a doctorate in occupational therapy? And my answer is always very quick because it's an easy answer for me, and I always say absolutely.